Hello, I'm Shana Davis, and today I'm going to be talking about anxiety in older adults. I'm going to give a brief explanation as to what anxiety is, how anxiety affects older adults, how anxiety can be identified in older adults, and how older adults can combat anxiety. What is anxiety? The American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. These physical changes also involve trembling, sweaty palms, faster heart rate, and even difficulty talking. Anxiety can be different from person to person. For example, when I experience anxiety, I feel a tightness in my chest, my hands become sweaty, and I tend to talk very fast, sometimes to the point where I stumble over my words. I also have racing thoughts focused on what is causing my anxiety. These are the symptoms I experience, and they may be the same or different than other people's experiences. Men and women have different symptoms, and even older adults have different types of anxiety than younger adults do. There's a lot of different types of anxiety disorders as well, but I'm not going to cover the different disorders. Helplessness anxiety. In older adults, the causes of anxiety aren't the same as those in younger adults. One type of anxiety, called helplessness anxiety, is the potential loss or actual loss of control or mastery. This can involve anything from being able to move on their own, memory concerns, or health concerns. For example, if a person can no longer reach the top shelf of a cabinet or pick something up off the ground, they may start to feel anxiety over being helpless or a burden. Anxiety about health. As people grow older, their health is going to change, usually in a decline. This decline in health can lead to anxiety and is considered a secondary cause. Secondary causes of anxiety can lead to difficulty diagnosing anxiety in older adults because it's important to distinguish symptoms of anxiety and symptoms of a physical condition. Some symptoms of anxiety in older adults are sleep disturbance, muscle tension, frequent and uncontrolled worry, and distress and impairment. These symptoms can be symptoms of other conditions, usually physical conditions, so it's important to know what's caused by anxiety and what's caused by a pre-existing condition. For example, my father has an autoimmune disease. He worries a lot about his health and about getting sick. He has a lot of anxiety during flu season, specifically because if he does catch the flu, there is a high chance he might die. Geriatric anxiety assessments. One way doctors can determine if an older adult has anxiety is by performing a geriatric anxiety assessment or inventory. They ask questions that are related to anxiety, such as the ones portrayed here, and they total up the score to determine if the patient possibly has a generalized anxiety disorder or does not. Some of the questions or statements ask about how tired a person is, about their mood, and about physical pain. It only notes a possibility and isn't concrete, as there could be underlying factors, such as a physical condition that makes a person feel tired, have tense muscles, and causes them to wake a lot during the night. The statements shown here are from a geriatric anxiety assessment in the United States. There are different assessments for different countries, such as China, Iran, and Australia. The different geriatric anxiety assessments don't always portray the same statements. This shows there are different symptoms for anxiety depending on where you live. Treatment for anxiety. There are 3 different ways a person with an anxiety disorder can be treated, which are psychotherapy, medication, or a combination of both. While medication can be prescribed, it's important for patients to be monitored for side effects of the medication they're taking, as they could have a reaction with other medications. Psychotherapy is an umbrella term for several different therapy techniques, including relaxation therapy, cognitive behavioral therapy, and acceptance and commitment therapy, all of which are therapies that have been shown to help older adults living with anxiety. If you're interested in learning more about anxiety in older adulthood, here are some open resources about anxiety in older adulthood you can check out.